Oh, I'll be brave if you're brave. I'll be brave, but only if you're brave. And it could be just you and me. We'll be family. Just wait and see.
Good evening, everyone. Welcome to tonight's Lung Cancer Living Room. For those of you who may not know me, I'm Danielle Hicks, Chief Patient Officer here at GoTo Foundation for Lung Cancer. I know a lot of you are used to seeing Bonnie Adario here with me co-moderating. She unfortunately had a conflict tonight and is unable to join, but I have no doubt that in spite of that and the fact that everybody always wants to see Bonnie, it's going to be an amazing show tonight. We know that there are people watching that come from all around the globe and consist of patients living with various types of lung cancer, undergoing various types of treatment. And we just want you to know that we're here for you and that we believe wholeheartedly that educated and empowered patients do better. So thank you for joining us. Tonight's conversation, as you may know or you may have seen, is around financing your lung cancer care. There have been many advances in lung cancer therapies that have fantastically resulted in improved outcomes for people diagnosed, but unfortunately those advancements don't always come without a price tag. The high cost of some of these therapies pose significant challenges, we know all too well, to some people living with lung cancer. And tonight we're going to talk about resources and navigation techniques to help ease some of these burdens and some of these out-of-pocket costs that come along with cancer care. We have Clara Lambert with us, who's Director of Financial Navigation at TAILORMED. This is her second appearance with us here at the Lung Cancer Living Room. So welcome back, Clara. We're so happy to have you. Before we jump into the program, I'm going to ask Clara to give us a little introduction of herself, who she is, and how this financial navigation piece of cancer care came to be a passion and ultimately a career choice for her. So Clara, I'm going to turn it over to you.
All right. Well, thank you very much. And thank you for having me back. I really appreciate that. So I'm a financial navigator, and it's a relatively new position. But what I do is I help people understand their insurance and benefits and how their treatment is going to cost with those benefits, and then look for resources to help pay for it. And I've been doing this as a job officially since 2013, but unofficially, I navigated my husband, or actually our whole family, when my husband was diagnosed with cancer. And we had 3 small children. And we made just enough money to, not qualify for a lot of things, but we weren't making enough money to pay for the treatment. And then we also, I call it the double whammy because of the fact that he was diagnosed late in the year. We had to meet our deductible and out of pocket for 2 years in a row. So I remember I was sitting with him while he was getting his treatment one day, and I was feeling rather proud of myself because I had found some pretty decent resources that were helping us pay for his treatment, but also like just helping with making sure we had food on the table for our kids. And I thought, wow, I wonder if this could be a job. And it took about 7 years for that to come into fruition. But when our local hospital that I started working at was getting ready to build a new cancer center, I was able to create the position and help develop it. And since I've moved to the Chicagoland area, I'm working in another hospital, and now I actually work for a software development company that is building software to help people who are advocating and navigating oncology and other patients with chronic diseases.
That's great, Clara. And probably at some point later in this conversation, I'm going to ask you to maybe talk a little bit about that software and how you're hoping to implement that and how it may, ultimately benefit patients. And it's interesting because I think, similarly, the role that I'm in and the work that I've been doing for the last 15 years wasn't something that I had originally aimed to do, but I found myself in because of personal life experiences. And so thank you for continuing to work beyond just your family and your own personal experiences, but for those out there who are in such need of this type of support. So I want to kind of jump into the program, but before we do that, we hear a lot, this phrase, financial toxicity. What do we mean, or what do people mean when they talk about that?
Yeah. So normally a side effect of like treatments or cancer is they call toxicity. So they've decided to coin financial toxicity, the side effect of the cost of cancer. And then also what ends up happening is people make decisions based on how they're feeling about their finances. One of the things I always say is that people, when you get diagnosed, you kind of have your financial backpack already. You either have some savings and assets, and you're able, to pay your deductibles and your out of pockets. But there's also a lot of people out there that have previous debt. They are living paycheck to paycheck, so any additional costs put a huge strain on them. And so they have to make choices. Do I buy groceries? Do I buy my medicine? And they've done studies where like 50% of people are actually worried about how they're going to pay their bills if they get sick. And then another study that was done was, okay, so what do people do when they're feeling like that financial toxicity? And so anybody who goes and gets just like 15 days or 10 days or, out of their 30-day prescription, they're making a choice because they can't afford the full thing. Or if the doctor prescribes, let's say 2 pills, and you decide, I'm going to try and make this last longer, I'm only going to take 1. So you're making decisions based on your money, but they're also going to affect your outcomes. So that's why the term is financial toxicity.
So it's really interesting. And I think, we're going to jump into some varying aspects that kind of fall under the umbrella of where these financial, toxic sort of environments live. But it's not always even just copays or deductibles. To your point, sometimes it's groceries and gas and children's college educations or right. So I think it's such an important conversation, and I'm so thrilled we're able to talk about it tonight. So I want to start with health insurance. When we're talking about navigation and some of the support that you may be able to get or not get or think you can't get from your health insurance provider, how important is health literacy to you? Because I know for myself in particular, half the time if I need to go in for a general procedure, let alone, something that has to do with dealing with a disease like lung cancer, I am troubled by how to figure out how to navigate it. So how important is health literacy or understanding your health insurance plans? And what do we mean when we talk about this?
Yeah. So, health insurance literacy is, it's understanding your insurance, understanding the basic terms, but then being able to utilize your insurance to your benefit. So like putting that all together and then making it work for you. And I think that there's a lot of varying levels of it. One of the things that I've recently put together is at different stages of your life, you have different types of insurance, and your insurance, each different type of insurance works differently. So if you've ever been in a point in your life where you've been extremely low income and had to be on Medicaid works differently than employer-based insurance. The Affordable Care Act insurance works pretty much the same as employer insurance. However, how you pay for it and the cost subsidies are very different. And then if you're at a point where you're disabled or 65 and older, you have Medicare. And that works even different than Medicaid and even different than the ACA plans or an employer plan. And now they've complicated it by adding also Medicare Advantage. So I think like it seems like every 15 to 20 years in your life, you have to like start fresh and learn a different way that your new insurance is working. So I think that makes it very complicated. Um, but also, people are making choices when they do have the capability of selecting insurance based on how much the premium costs, not based on the whole entire cost. So if you do that, you might end up in the long run paying more. And I think one of the examples, my husband just changed jobs and he had three insurance choices to look at. And so we looked at them side by side. And one looked like, okay, so they're going to take $20 a paycheck out. But the out of pocket maximum on that was $8,000. And then the next one up was an additional $15 a paycheck. The out of pocket maximum on that one was $4,000. So a lot of people would just pick that first one that's $20 a paycheck and then not realize until they get, a diagnosis where they're going to end up using that they're going to end up paying not only that $20 a paycheck, but also $8,000 out of pocket. Whereas if you sometimes spend a little bit more, then you could greatly reduce your overall costs.
So it really boils down to looking at your options, knowing your options, and comparing those plans. So for an extra $15 a month, you could be saving yourself $4,000 in this example that you just gave out of pocket every year. So it's kind of knowing what your options are. So when we're talking about insurance, whether it's Medicare or a private insurance company, there's typically an annual enrollment in both, correct? So if your situation were to change, there's an open enrollment process. Can you talk about what that might look like? Particularly, I think a lot of folks maybe know in the private payer sort of space that's a thing, but I don't necessarily think, based on folks we talk to, that they know that that's a thing when it comes to Medicare. Can you talk a little bit about that?
Yeah. So every year with Medicare, there's an annual open enrollment. They open at the dates. They open in October and they're open till December. And that's for either choosing your Medicare Advantage plan or the Part D plan that goes into effect on January 1st of the following year. The healthcare marketplace also has an open enrollment period in the fall. Theirs goes a little bit further into December. And again, that's for the plans that are going to start on January 1st of the following year. Each employer has an open enrollment generally 2 to 3 months before the health plan goes into effect. A lot of plans are calendar year January 1, but occasionally with an employer into a plan that follows the company's fiscal year. So like right now, mine starts on July 1st. So my open enrollment is in May. But usually, like about 2 months before when your plan would be starting, that's when you have the capability to make any changes. Other than that, if you have something that happens with your family, let's say somebody gets married, well, within 60 days, you can add that new spouse, or, like having a baby or adoption, death, all of those, you're able to make changes with your plan within 60 days of that occurring. If you lose your job, then you can go to the Affordable Care Act, or you can get Cobra coverage. But you do have like specific time limits that you have to make those decisions in.
So that's interesting, especially when we're talking about, like you mentioned, Cobra. And I think there's some folks out there who may not know what that is. And I think it's really relevant for a lot of folks dealing particularly with a late stage lung cancer diagnosis, is they are unable to continue their work, right? So can you explain what Cobra coverage is for those interested?
Yeah, Cobra has a really big name that doesn't really make sense. So we'll just call it Cobra. So what Cobra is basically it's allowing somebody to keep their employer insurance for an additional 18 months. And that decision has to be made real quick. Your employer, from the time of the life event, the employer or the administrator that's taking care of all of the business aspect of this for your employer has 30 days to send you a notice that says that you're eligible for it. And then you have 60 days to decide, yes, I'm going to use this, or no, I'm not. And just so you know, if you say no, you can change your mind in that 60 days. Same with if you say yes. If something else comes along that's going to work better for you, you can change your mind. That whole 60 days, you can change your mind as much as you need to. It's good to, try to weigh your pros and cons before you make the choice, but you are allowed to change your mind. So one of the things, though, is when you have insurance through your employer is usually paying about 75% of your insurance premium, and then you have about 25% of it taken out of your paycheck. So now, if you're no longer working, the employer is no longer going to give you that benefit of them paying a portion of your health insurance premium. So Cobra usually costs a significant amount more than what you've been paying. And that can be, considered a hardship. So you've got the choice of electing Cobra. You also, if you are not yet eligible for Medicare, you have the choice of going to the Affordable Care Act in that 60 days and choosing something from there, which sometimes that might be a better idea because you can get help with your premiums. And there's also, depending on your income, can lower your cost sharing, lower your deductibles and your out-of-pockets. It's one of those things you kind of have to get your calculator out and see, like, if it's towards the end of the year and you've met your out-of-pocket, and it might cost you less to stay on Cobra just through the end of the year and then enroll into a different plan for the following year. So I always tell people, like, get your calculator out, do the math, and like, how much is it going to cost me? I've met my out-of-pocket with with my employer plan. Will it cost me more to pay the Cobra premium, or should I switch to a new plan?
But to your point earlier, Clara, and I think this is a really, really good information, and I want to reiterate, even if you choose Cobra, it can be for a limited amount of time, so 30 or 60 days, while you're trying to sort of dig deep into figuring out what other options may be available for you. Because I think most people think if I stick with Cobra, that's my insurance for the next 18 months, and that's just kind of,
Yeah, not for the next 18. Yeah, it's not for the next 18 months. However, if you do choose it, you do have to use it for the rest of that year. Okay. So you can't cancel your Cobra and then move over to the Affordable Care Act, because you need to do your Affordable Care Act special enrollment within your special enrollment time period.
Got it. So I'm a patient who is no longer able to work. I either choose Cobra through the end of the year and or choose a different option, such as something through the Affordable Care Act. Got it. Okay.
And
I was wrong. So I want to clarify that I heard that wrong.
Okay. Yeah. Well, I'm glad you asked, because, so once you elect the Cobra, there really isn't a good special enrollment for getting out of it, because they do say that not being able to pay premium isn't a valid reason for canceling insurance. Although I think that, they're not always hearing what's happening to people. So, but also there are programs that help with premium assistance. And like this year, the Affordable Care Act, if anybody has been unemployed and, gotten unemployment benefits, anybody in the family, then you get the full subsidies to help with the Affordable Care Act. So that doesn't happen every year, but from what I understand, for 2021 and 2022, that's going to be in effect.
Yeah, I think it's great. It's so important. I think about my own sort of personal experience, again, outside of a lung cancer or cancer diagnosis, or a diagnosis where the treatments might be cost prohibitive. I know just what my premiums are, in spite of the fact that I have a wonderful employer who does cover, me, as you were stating earlier. I still have to pay for my children, right, and my spouse, and just those premiums on my kids are getting older and kind of falling off, so it's easier on me now. But at one time,
Mhm.
it was a lot of money just in premiums going out every year. So it's always really this has always been a situation that's really tugged at my heart when we get folks calling up who are struggling with this, because I can't begin to imagine what the true struggles are when dealing with
Yeah.
this. So we've talked a little bit about, and please, everyone, I just want to remind you that folks are monitoring the chats online, but if you have a question specific to Clara, if you just call it out in the online chat, they will get us that question so we can go ahead and ask. And this is confusing. Again, I've been doing this for a long time, and it still confuses
Mhm.
the heck out of me. So please don't hesitate to ask a question. So we've talked a little bit about some of the options through Medicare, Affordable Care Act, private insurance, Cobra, et cetera. Again, what I can tell you from personal experience and from talking to folks is navigating these plans can be insanely overwhelming. Quite often they come with either a hard copy, booklet that's this thick, or miles and miles of a digital PDF trying to explain it to you. Are there any resources out there to help folks navigate this process? And if there are, what are they, and is there a cost typically associated with it?
Yeah, so there is free navigation. If you have Medicare, it's called SHIP, or the State Health Insurance Program. And so there's people in each state who are trained to help you look at Medicare programs, understand how they're going to work. The Affordable Care Act has navigators and certified application counselors to help when you're looking at plans. And I know that right now, a lot of them are happening virtually, but there are, they have been in person in the past for both of those. And then as far as your health insurance, I know that Human Resources Department is not always the best at this. They think that, the really snazzy graphics that they've sent you in the mail 5 times do everything for you. But just keep asking, and you should find somebody that can help you, like compare these plans side by side.
That's great. And I think I just want to take this opportunity to remind folks too that, and I know the helpline number keeps kind of coming up on the bottom third of your screen here, but we are able through that helpline to direct you towards some of these resources. So if we're talking too fast and you aren't able to write it down, please feel free to call the helpline. We've got some amazing folks on the other end there, ready, willing, and able to help direct you in this crazy sort of spaghetti bowl of navigation process. So I want to kind of take a step away from some of these resources. We talked about, the HR department, SHIP through Medicare, state health insurance programs, and of course the Affordable Care Act. When you and I were talking, I think it was last week, you mentioned something that I personally had never heard of before, and you did a beautiful job explaining it to me. And that's what you called catastrophic coverage. What does that mean? Can you talk a little bit about what it is?
Yeah. So that has to do with the Medicare eligible people, and it has to do with their prescription drug coverage. And it's going to happen either with a standalone prescription drug plan or with a Medicare Advantage plan. And basically, there's 4 steps that your drug costs go through. First, the deductible. And in the deductible phase, you are basically paying full price for that drug until you meet your deductible. So if you have a $400 deductible and your drug costs $300, you're going to pay $300. Then the next phase is where you see, when you're looking at your plans, the different tiers. So tier 1, tier 2, tier 3, tier 4, and specialty. And in the different tiers, they cost usually different copays. So like you might have $5 for this type of medication, $10 for this one. And then if you're getting into the specialty medications, which would be like an oral treatment, then you're usually paying a percentage. So you pay that until you and the health insurance company have paid out a little more than $4,000. I don't have the figures direct in my head. I usually use a cheat sheet. I don't have it in front of me. So once you and your health insurance together have paid the $4,000 amount, then you are in what they call the coverage gap. And then you're paying a percentage, no matter what tier your medication is in, you're paying 25% and your insurance is paying 75%. You're in that gap until around you and your insurance company. So together you have paid, it's a little more than $6,000 total. So it includes that $4,000 for your medications. Once you get to that, then you get into that catastrophic coverage, and the medications come down very significantly. So usually the most you're going to pay is 5% of the drug cost, but a lot of the lower cost meds will be, around $3 for a copay.
So I think this. Go ahead,
Yeah.
Clara, sorry.
So one thing with like the oral specialty medications, you can go through all 4 of those phases with one bill, interestingly enough.
So explain that. I don't think I understand what you're saying.
Yeah. Okay. So like if a medication is going to cost more than $6,000 just overall, you can go through that. You can
Got it.
have
You can already get down to catastrophic.
Boom, do that in one fill.
Yeah, and I think that's very relevant, particularly, in the era of precision medicine and comprehensive biomarker testing, and really trying to find some of these targeted therapies, primarily oral therapies that target specific biomarkers within a cancer. Those drugs are very, 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 very expensive. And I know a lot of the calls that we get are about that. And how do I pay, for a drug that costs, $20,000, $30,000 a month for me to take a pill a day? And so that was what I was going to ask, is how long does it take to kind of drop into this catastrophic coverage where those numbers do come down? So You're telling me if there's a way you can afford it just once, especially in the instance of a drug that maybe is this expensive, then you can get the support you need. My question for you, and then I have a couple of questions from the online group, is do patients know about this? I mean, is this something that's discussed?
I don't think they know it as well as, I think it's one of those things that this is an insurance that works differently than any other insurance that they've had, like in their working life. Now they have Medicare. It was the beginning of December, and I was in line to pick up my prescription, and there was a gentleman in front of me, and they were asking him for $2,000. And he's like, I usually only pay $50 for this. And they're like, well, it's $2,000 this time. And I was like, oh my goodness, I know what has just happened. He's in the coverage gap and he's paying that 25%. And it was December. So I don't think it had ever happened to him before on this medication, because all the other years he'd made it through the year without it even happening to him. So it's one of those things that it's not going to happen to everybody. And then some medications can take you through it in 1, maybe 2 fills. And some people, they might not get to that. But, pharmacists and pharmacy techs know about it. But the thing is, though, is like, I think sometimes you have to ask, can you tell me why it costs this much this time?
That's interesting that you, as just sort of this innocent bystanders, just standing there waiting, had information that it doesn't sound like anybody explained to him, other than to say, this is what it costs this time. Maybe next time it won't be this expensive. And I have found myself, and I'm sure others watching have found themselves in this this exact same situation where it's the same drug, same prescription, and all of a sudden, you're skyrocketing. So I think that's really useful information. And again, for more information on what these gaps are and what this process looks like, please don't hesitate to reach out. I do want to get to a couple of questions that have come in online. So the first one is, I have Medicare with a supplement. What is the best supplement with Medicare?
Okay. So, well, I've always been trained because I worked in hospital systems. I can't tell you what insurance to select. However, supplements are, the A, B, C, F. So, if you have Plan C or Plan F, they are not selling those anymore because they pay the Part B deductible and the Part A deductible. So basically, you have almost 100% coverage as long as you don't have like a high deductible version. So if you have Plan C or Plan F, keep paying your bill and keep it because you have virtually 100% coverage for all your medical costs. And then you just need to have a Part D and prescription plan on top of that. And with that, every year you need to go to Medicare Plan Finder and put in your list of medications and just make sure that everything's on the formulary. You can still go to the pharmacy you want to go to, and that it's the best. It'll show you the best plans for you in your area with your medication list.
And what if you don't have C or F?
Okay, so if you don't have C or F, A is the most basic. A pays it pays that 20% that Medicare doesn't pay. So really, as long as you're not picking one of the ones, I think K or L, you should be fine because K and L have higher out of pockets. So you might end up having a couple $1,000s out of pocket with those. M and N also have a high deductible or a high out of pocket version you can get. I think if you're paying a premium for a supplement, don't get one of the high out of pocket ones, and you should be just fine. So I think in place of C is now D is got all of the coverages except for like the Part B deductible, which for this year was $203. So if you have Medicare and a supplement, you might have your Part A deductible, which is $1,400 if you get admitted to the hospital as an inpatient, but you'll for sure have your $203 or, in next year, I'm sure it's going to get higher, but your Part B deductible. But the supplements are a really good choice. I highly recommend the supplements.
So that's a perfect segue into the next question where a caregiver, family member is saying, my father has a Medicare Advantage PPO plan. We're learning how restrictive it is, despite it being a PPO, trying to get their father into a supplemental plan. Where can they go for more information to navigate? I think what you've sort of touched on, but to get more sort of one-on-one help with that.
Yeah. So Medicare Plan Finder is a really good place to go. You can look for what supplements are available in your area on Medicare Plan Finder. The supplements have to be purchased through a commercial health insurance company. And if your father, I believe you said, yes. So if it's outside of that first 6 months of having Medicare, he's going to have to go through underwriting. So it could cost a substantial amount if they allow him into a supplemental plan. But I say go online. It asks you what level of health you think you're at, and it will tell you what's available in your location and what insurance companies you can purchase it from. And it can't hurt to ask. But
That's great.
I do want to let you know that it might be that now that you're with the Advantage plan, you might have to stay with it.
Can you repeat that resource just so people can write?
Yeah, so it's called Medicare Plan Finder, and it's on the website medicare.gov. Perfect. But also the state SHIP coordinators could help you look at those.
Great. Okay, third question, and then we'll jump into our agenda, because the fourth question I think we're going to get to, so we may be able to help unless there's further questions after that. But the next question is, do you know if targeted therapies, the oral ones that we were talking about, not infusion chemotherapies or other infusion therapies, come out of Medicare Part D or Part B?
So typically they're going to come out, typically an oral therapy is going to come out Part D, like David. The only reason that an oral medication would come out of Part B is if they make an infused version also, and the dosages are pretty much the same. So that's like a technicality. There aren't a lot of those. There's some.
Great. Okay. So, I think when you and I talked, and Michelle was on the phone talking, with us about this. And again, for all of you folks watching, trust me when I say I know how confusing this is. And I'll reiterate that I've been listening to and trying to navigate this for patients for a long time, and it still confuses me. When I talked about folks being underinsured, you kind of made a comment about, well, technically, a lot of, whether it's private health insurance or Medicare, you automatically, depending upon what your needs are, can be underinsured, and behaviors that we're seeing trend in patients who are really struggling. And you talked a little bit earlier about non-adherence to treatment protocols. So, sort of trying to spread out their treatments or their therapies or medications, not adhering to appointment schedules and canceling appointments, which ultimately, results in a lessening of quality of life and poorer outcomes. Like, what would you say to these folks, when it comes to this and understanding? And it absolutely breaks my heart. I remember I talked to one gentleman who was like, listen, I live in such a rural area. My healthcare provider is 2.5 hours away, and I cannot afford the gas to get 2.5 hours back and forth, once a week. What is your sort of, greatest advice at this point in the conversation to folks like that are sort of trending towards non-compliance, for lack of a better term?
Yeah. So before you make any decisions that would be considered non-compliant, find out if your cancer center or your healthcare system had somebody like me, a financial navigator or a financial advocate. Sometimes they call them financial counselors. But if you ask specifically at the cancer center, they should be able to connect you with somebody who can help you look for resources. There might be copay assistance programs that'll help, meet those costs for you. And then there's also different programs that help with living expenses. They help with transportation to treatments, because there are a lot of rural areas in the United States, and there are a lot of people that are traveling several hours one way for treatment. And then put on top of that, what if you have to have radiation treatment every day? You might as well just stay in a hotel for 5 days. But there's, hospitality houses and different programs to help pay for, travel and lodging in that type of an instance. And usually, a hospital that has patients that are coming in, or cancer center that has patients that are coming in, and they know they're coming in from great distances, they have ways to help you. So, I know it's hard sometimes, when you've been self-sufficient with so much, to say, I need help. But that's one of the very first steps, is reach out and ask for help. And if you can't do it, have somebody who loves you do it for you or with you.
Yeah, it's one of my own personal frustrations, and I'm sure the frustrations of many, is that, the policies, procedures, and protocols that are being decided on and put in place, for the most part, are being put in place by people who have never walked these roads, right? Or who
Yeah, definitely. I think that's one of my big eye rolls. It's like, all right, they need to come live a day in our shoes and then make some of those decisions that they're making. But that's going to lead me to another thing is I have gone to Capitol Hill and I have gone to my state. And I think it's very important. They will listen to you. They love hearing personal stories because that is how they walk a day in their constituents' shoes, is by hearing those stories. So if you ever, have that opportunity, if there's something going on as far as policy and advocacy, advocate for yourself or advocate for the people you love and go tell those stories. Make it real for them.
Absolutely, Clara, and we really hope to see you at our Voices Summit in 2022 to help us do just that. We have such a strong voice up there, and I hope Elridge, who's our senior director of all things policy related, is watching tonight, because I'm sure if she is, she's sitting behind her computer clapping, because the patients' voices are so incredibly important in creating and literally affecting change. In things like this. So another
reaching out and asking for help, then like help. People like me can do that. Yeah, people like me can go to the Hill for you or with you.
Yeah, agreed. And I'm going to jump into what sort of this laundry list of help in a second. Just to kind of go back for a minute. Quite often, we've been doing a lot of talking about sort of struggles, or strains that are common when patients are going through treatment. And I think one of the sort of lost soldiers in all of this are the caregivers, who may be having to take time off of work, thereby losing salary, thereby greater affecting what the bottom line looks like for these folks. So help indeed is much needed in a lot of instances. Before we jump into sort of the best places, I'm hoping this is going to resonate with you, because the way it came through on chat, I'm not really sure the context, but guarantee right issue. Does that ring a bell? If it does not, if somebody could.
Yeah. Okay. So they're talking probably about guaranteed issue for like the Medicare supplements that we were talking about, would be what I'm going to assume, because the wording sounds pretty similar. So the first 6 months when you become eligible for Medicare, you are eligible for guaranteed issue with the Medicare supplements. So you don't have to go through that underwriting. But as soon as that 6 months is up, then you have to go through underwriting, and you're no longer in that position where they just have to give you the policy.
Okay. I'm betting that you're right based on your description of what it means. It sounds like it tied right in with one of the questions that came in previously. So in your opinion, and based on your experience and the work that you do and the resources you try to provide for the folks that come to and through you, where's the best place for someone in need to start to look for this type of help?
Yeah. So like I said, very first is ask for help at your cancer center. Because if they have somebody there on site, they know the national resources, but they also know local and regional resources. And I think I always say go there first, because you've got to make these national ones last, help everybody. But if there's a resource in your community, then that's usually the very, very first step to go to. And so they can help you with, usually transportation, living expenses. But, we've been talking about people who have high out-of-pocket costs for either their medical, for the infused treatments, or for their prescription for oral treatments. And there are several really wonderful copay assistance foundations, and I hope I don't omit anybody, but we've got Cancer Care, Good Days, HealthWell, PAN Foundation, the Patient Advocacy Foundation, which is copays.org, the Assistance Fund, and they all help people with their medical expenses. And they have disease-specific funds for both. Most of them now have both non-small cell and small cell lung cancer funds. They're not always available immediately, but they do go retroactive. Depending on the fund, they can go back 30 days to 6 months. So I know it's a lot more difficult with having to pick up a prescription, like, okay, I'm going to pay this huge prescription and then hope a fund opens up and will go back far enough to reimburse me. So if that's the case, a lot of the manufacturers allow you to apply for their free drug program. So I would say ask about that too. Definitely, if you're at the pharmacy and something is a couple of $1,000s, it's highly likely that the manufacturer has a program that you can apply to get that for free from them, directly from them. So apply for that.
Sorry, I didn't want to cut you off. I think, yes, you've touched on a lot of them. And yes, and even more importantly, and pointing back to you saying and reiterating a couple times, reach out and ask for help, right? Because of this retroactive sort of option, even if you can't get it right now, when these sort of buckets, like I so fondly call them, internally do open back up, you can be on the list for assistance there. I know quite frequently the amazing folks that we do have on our helpline are trying to navigate people through some of these financial assistance programs. And you're absolutely right, particularly in lung cancer. Usually, as soon as they open, they close fairly
less than an hour.
Yeah. Fairly quickly, which is frustrating for us when we're trying to support the folks that are calling, and even more frustrating for the folks that are calling to know it was there and now it isn't. Mm-hmm. But if you get on these lists and keep sort of poking the bear, if you will, that opens up that opportunity.
Yeah. And several of the foundations have wait lists now, so you can put your name on the wait list and be like next in line. Then they'll send you and say, hey, we've got funds. You have 48 hours to tell us you still need it. So get yourself on wait lists and then make sure you're watching your emails and responding to your emails because you have a limited time period.
That's great. I want to continue on this list, but first, I think the person online that was looking for the guarantee issue, they had a follow-up question that I want to make sure I get answered because I'm being mindful of time. We've got about 12 minutes. It says under the guarantee thing, does it start again if someone moves?
No. Nope. It is only for that first 6 months that when you first turn 65, you've got 6 months of guaranteed issue.
Got it. I hope that was helpful. So when we're talking about looking for help and searching for some of this navigation assistance, you mentioned pharmacists. And I think me personally, I think of my pharmacist to maybe ask what side effects of a medication might be, but not necessarily to ask about what type of, assistance programs might be available for me to help afford my drugs. Which was really interesting. I don't know if there's anything more to say about that than just to kind of reiterate that that's a thing.
It is. Yeah. So there's usually people, especially if they're a specialty pharmacy, they know their drugs cost a lot of money. And so usually the pharmacists know about the programs and also the pharmacy techs who are helping, at the counter, on the phone, that kind of thing. They usually know all about how to get you enrolled. And so like in a cancer center, you'd have a financial advocate, a financial navigator. At a pharmacy, you're going to have the pharmacy tech pharmacists, and they're going to work together. They want you to be able to fill your prescription. And so if there's a program available, they will, help you with finding that.
Great information. And then one last thing, but most definitely not the least thing, are pharmaceutical companies and their assistance programs. Can you talk a little bit about what those look like and how people might apply for assistance directly through the drug manufacturer?
So directly through the drug manufacturer, there's two different types of programs that are available or could be available. They're not for every medication out there, but usually the brand name medications that don't have a lot of generics available have programs. So the first type of program would be copay assistance. You can only get copay assistance directly from a drug manufacturer if you have private health insurance. If you have any government-sponsored insurance, like Medicare or TRICARE, you cannot get copay assistance directly from the manufacturer. That's where those foundations with the disease-specific come into play. That is a resource for somebody with government-funded insurance. Then the other thing that would help somebody with government-funded insurance would be the free drug programs, especially if your foundation is not open and you need to fill that prescription now. Then you can apply to the manufacturer and you go through a whole application process. They usually have income limits, but then they would provide you that medication for free through that program.
That's great. So before I move on to the next thing, I just want to again reiterate, because I think it's so important. Some great places other than what we talked about earlier, which was the Medicare SHIP program, state health insurance programs, marketplace navigators, healthcare.gov, which we've talked about. Some of the great first step places are your cancer centers themselves, knowing that some of them are more rural and may not have, huge multidisciplinary teams, and not all of them are going to have social workers or nurse navigators. Most of them will have at least something, whether it's somebody from the administrative department, or others that can help you navigate that. Pharmacists, ding, ding, ding. This was a really big one for me. Outside resources within the community, pharmaceutical assistance programs, which we just talked about, and then nonprofits such as Pan Cancer Care, Patient Advocate Foundation, and others, Chronic Disease Fund. There's multiple resources out there to help with this financial assistance. I also want to just make sure that I clarify that at GoTo, and again, the 800 number for the helpline keeps popping up, we are able to help you navigate and find resources specific to your needs. But I don't want anybody to misunderstand and think that GoTo Foundation for Lung Cancer actually provides independent financial assistance, because that is not something we do. And I certainly don't want you to be disappointed if you call and I haven't cleared that up here tonight. But we can most definitely help to point you in the right direction and towards all these places that Clara has so beautifully sort of laid out for us tonight. So we've got, a few minutes left, Clara, and before I jump into my final thoughts, I just want to see if you have any other advice you would like to maybe give people who may be watching, or something that maybe I missed that you think is important.
Oh, I think we've actually done a really good job of covering almost everything. I think every year, take a look at your insurance plan, make sure the medications you're on are still on the formulary. And then, like I said, just don't be too proud to ask for help. Everybody needs help sometimes, and there's great people out there all across the nation that are ready and willing to help you find resources. So I think that's the biggest thing, is just don't be afraid to ask for help.
Thanks, Clara. So important. And I'm so grateful for you and the services that you have and continue to provide to this community. I want to just talk a little bit about some of the work GoTo has done and continues to do in this area. As a member of the Coalition to Improve Access to Cancer Care, GoTo Foundation is advocating to advance the Cancer Drug Parity Act that was introduced in the last Congress. For those of you who are keen on sort of the language of Congress and what happens there, it's S741 and HR 1730. This bipartisan bill could substantially help patients who are unable to access their medications by standardizing cost-sharing systems across IV, oral, and other self-administered treatments. Many patients with cancer today, as we've kind of talked about, are covered under insurance policies which require patients to pay higher out-of-pocket costs for anti-cancer treatments delivered orally instead of intravenously. And we touched on this a lot about the high the high cost of some of these pills or targeted therapies. This is because insurance medications taken by mouth are covered under prescription drug benefits rather than medical benefits of insurance plans. So that lack of oral parity has become a critical advocacy point for GoTo Foundation and the broader cancer coalitions. So I just want to make sure you guys know that we've got our eye on the ball and ultimately the prize. We've also partnered with other advocacy groups on a letter specifically asking for reform on out-of-pocket costs in Medicare Part D, the focus of Dr. Goulart's study, along with the cost of care issues. Our policy work covers many areas important to people with lung cancer, and we've got recent policy letters available on our website at gotofoundation.org that include advocating for comprehensive health coverage and clinical trial costs along with funding lung cancer research. So I just want you to know we are, of course, continuously seeking to empower patients and help to reduce their own risk of financial toxicity. And we really, really, really hope you have found tonight's topic helpful. More to come on this. We are not done talking about this. We are not done fighting the fight and trying to get you guys the best care and the best medicines possible. So again, I know I've said it 100 times, but I cannot say it enough that we are here for you and to help you navigate this in any way, shape, or form. So with that, I'm going to say a huge thank you to Clara. I've got like 3 minutes left. Huge thank you to Clara for coming out again and having this oh so important conversation with us. If you guys have more questions that either weren't able to be answered online and or I wasn't able to get to tonight, please email them to us, and you can email support at gotofoundation.org. Sorry, and we'll have somebody get back to you to get those questions answered right away. Our next living room is September 21st, and it's about building community and advancements in small cell lung cancer. We have our friend Dr. Charles Rudin coming out to talk with us about that. So be prepared for a really exciting conversation there. Historically, the laundry list of things I've done at housekeeping has become sort of this, it feels like this big GoTo Foundation commercial at the end. So what I'm going to tell you is, between our events, our registry, our newsletters, and all the wonderful patient support services, education, and programs we have to offer, please just go to gotofoundation.org. We're here to help you. And there's a multitude of ways that we can do that and that you all can get involved. So again, thank you so much to Clara, all of you watching live, or those of you who will come back and watch post live, Peninsula Television, as always, for being the back end of this program. The GoTo team, we simply, it takes a village, and I know that is such an underused phrase, but it's so insanely relevant. We've got an amazing team at GoTo working tirelessly for this community. So a huge, huge shout out and thank you to them. And then, of course, to our supporters, whom without we would not be able to bring this to you. Amgen, AstraZeneca, Bristol Myers Squibb, Daiichi Sankyo, Foundation Medicine, Genentech, Lilly Oncology, Merck, Novartis, Regeneron, Sanofi, and Takeda. Thank you, everyone, and we look forward to seeing you next month.
Oh, I'll be brave if you're brave. I'll be brave, but only if you're brave. And it could be just you and me. We'll be family. Just wait and see.